Okay.
Great.
So
I started the recording.
okay, great. I'm trying to see. Do I need to remove that? Got it. Or is it going to go away? Okay. Okay.
Yeah.
So like I said, we're the newest pathway here, and I'm actually new to teaching or being really part of the medical school education. My name is Neera Gupta, and I work at Metro Health, and I'm I guess the easiest thing is to say is I'm an addiction psychiatrist. So I'm a psychiatrist by training, and I work in the field of addictions. And I run our addiction medicine fellowship program now as the program director. So that's a little bit about me, and I'm excited to be here to launch our addiction pathway along with Dr. Parent.
And I'll introduce myself as well. So I'm Ted Perrin. I'm an internal medicine doc and an addiction medicine doc. I've everybody, please mute yourselves. There you go. So I'm an addiction medicine doc and an internal medicine doc. I graduated from CWRU in 1982 and have been doing internal medicine ever since, and addiction medicine since pretty close to that time. And this is a brand new pathway. We're so excited, Neera and I, to have been asked to help lead the pathway. It may be a brand new pathway, but we have a tremendous amount of experience with addiction medicine education here at Case Western Reserve over the last 30 years that I can verify, 35 years that I can verify, and longer than that. So I think that our level of excitement and our and the resources that are available to help guide you all if you choose this pathway in your to pursue your interests in addictions are tremendous. I think they really are tremendous. We as a team, Neera and I, are sort of working out the kinks and getting started with this. But as a university and as a faculty resource, a clinical resource, and honestly a research resource in the area of addictions, there really are tremendous opportunities for you all, and we very, very much look forward to working with any of you who wind up choosing this pathway as we go forward.
I can move it forward. So I just added a couple slides just to highlight that. This slide is to highlight that addiction medicine is more than just kind of a branch or a branch off of medicine. It's for me and talking with a lot of my colleagues, we do a lot of everything when we're working with our patients. There's a lot of advocacy work we have to do in terms of getting our patients care, getting them their needs met, especially, well, it's getting better, but it was initially quite a hostile environment and a stigmatizing environment for patients with addiction to get their needs met. So there's a lot of advocacy work. There's a huge social aspect that we have to tend to every day. We also, as a psychiatrist, I have to bridge across the medicine line and to make sure I know, some internal medicine. I need to know if somebody's infected because of injection drug use, things, so I have to use those skills, and then vice versa. I know that a lot of my colleagues who are in internal medicine or in other branches of medicine have to use some psychiatric skills and hone those skills. So there's a little bit of all of that. And then there's the spiritual aspect, I think, of working with patients with addiction as you kind of go through their journey of recovery with them and you get to bear witness, that process. And, it's really about kind of people going through a process and searching for meaning in their life and a purpose. And it really brings home some of these really psychospiritual aspects of medicine. I think that, so the art of medicine, as well as the science of medicine, as well as the social aspects of medicine, I think it bridges all of those things. And that's why I love doing the work. And I think that's why a lot of my colleagues do too. I just wanted to share, so it's very interesting because, and Dr. Parent, you probably can attest to this, that we have created a web of resources across the city, of people, of institutions. We work together because of the shared goal of treating people with substance use disorders. So if somebody asks me, do you know somebody who can treat, somebody who's incarcerated? Well, yes, I know one of my colleagues, she runs the addiction program at the county jail. So I worked on the detox protocols with another colleague for the county jail, so we know people and we can connect people because we all work together. And I haven't seen that as in any other form of medicine, but it's because we care so much for doing this work. And so we're able to create this web of a network, not only across the city, but across the country, of people we can connect to and connect patients to resources. So I don't know if you want to say anything more about that.
Yeah, it's pretty remarkable. So I've been back here in Cleveland since finishing my residency and stuff in Baltimore. Since 1988, and in general in medical care, at least on a clinical level, patient care level, there's a lot of competition between the sort of four major healthcare institutions in our area, between UH and the clinic and Metro and the VA. There really is a lot of competition clinically at the patient care level. And this is one of the areas where there really is a surprising and refreshing amount of collaboration. None of us have an adequate faculty infrastructure to really do the teaching, education, research that's needed within any of our hospital institutions when it comes to addiction medicine and addiction psychiatry, when it comes to treating patients and researching the issues of substance use disorder. However, between the four major systems, including the VA and the clinic, UH and Metro, there is a remarkable resource. And so, collaboration, cooperation, calling each other to give talks for each other, lining up electives for residents from one hospital where there aren't available electives so that they can go to another hospital system, is routine in the area of addiction medicine and addiction psychiatry in Northeast Ohio, and almost unheard of in most of the other specialties. And so I think that's sort of some real tangible evidence of exactly what Neera has been referring to, and I think it provides a great opportunity for students interested in this pathway, especially when it comes to rotating at different hospitals, as well as thinking about research. I think there really are some great opportunities, especially specifically because of that.
Sure, I don't know if you want to talk about the curriculum.
Sure. So we have, oh gosh, one of the challenges is since this has been developing literally for 35 years that I know of, and probably longer, there are a tremendous number of opportunities. And since this is a brand new pathway, there are very few requirements. So one of the things that you guys kind of asked at the lunch and learn, or whatever, oh my God, whatever that madhouse was over there in room 119 or whatever room we were in. There were great questions from you all about, what are the requirements, because you want to know what's required before entering something. So let me briefly mention at least what we're thinking about now as requirements. And then we'll go through some of these basically opportunities. And I have a 2-page Word document that that we will try to get out to all of you all. I don't know how we're gonna document who was here, but anyway, that we'll try to get out to all of you all. That explains this specifically. But for year 1 and year 2, there are basically three things that we're thinking about requiring. One is that there's an elective. Well, it's been an elective up until now called the opioid epidemic, the elective regarding the opioid epidemic. It's a student-run elective. It meets about 6 times in the fall, starting in mid-September. Neera and I are just starting to meet with the students next week for them to line this elective up. But for students in the pathway, it'll be a requirement. Typically, it is met on Thursday evenings from like 5 or 5:30 for an hour and a half on Thursday evenings for 6 weeks. And so enrolling in that elective and successfully completing that elective would be a year 1 requirement. A second year 1 requirement would be that we will pair you with a faculty advisor who's a clinician or researcher or person in the area of the identification, prevention, or treatment of folks with substance use disorders. And we have an expectation that that at least once every 2 to 3 months, you will be at least in email contact, and preferably intermittently in Zoom contact with that faculty advisor, talking about what your specific areas of interest are in the area of substance use disorders, and how you're going about meeting those areas of interest. And that faculty advisor, we would anticipate, would be a faculty advisor for you throughout your medical school career, however many years you're in your medical school career. It's a little bit vague right now in terms of our specific expectations with the faculty advisors, partly because we have just recruited a nice big group of faculty advisors, but they aren't completely familiar with what the expectations will be. So at least at this point, our expectation of your use of your faculty advisor will be to communicate with them and to let them know what you're learning, what you wish you were learning, and get some advice from them about how to learn what you wish you were learning with respect to substance use disorders and addiction medicine. So that's a faculty advisor. The third and last thing in the first 2 years that's a requirement, there's a lot more opportunities, but that's a requirement, is our seminars. We're in the process of organizing a Monday late afternoon, like 90-minute or so, at least 60 minutes, possibly 90-minute seminar series that will meet once a month, Monday late afternoon. So hopefully after Block 8 things have taken place. Right now we're thinking about 4 to 5:30, but if there are real conflicts with Block 8 things, we might need to kick that backward a little bit to 4:30 to 6 or 5 to 6. And we're recruiting a presenter to present for 40 to 45 minutes once a month on some aspect related to addiction medicine. Maybe prevention, maybe harm reduction, maybe community activism, maybe an advocacy, the way that Nira was talking about. Might be a person with a lived experience of addiction and recovery, sharing their experience over time, not only their own experience with recovery, but also their experience as a guide or as a mentor, a so-called sponsor to others coming into the recovery process. Might be a person presenting on their research experience. One of our faculty members, she's the associate provost for the university, has had a 25-year grant following cocaine-affected babies and an age-matched cohort that was not affected by cocaine. Multiple publications, and she's just a tremendous presenter and advocate for how to intervene to try to mitigate the effects of prenatal exposure to alcohol and drugs. So these kinds of people are available, and they'll be presenting. And our expectation would be that you would attend either in person or on Zoom a majority of the seminars that take place during your first and second year. Our expectation in the third year, when you're on the clerkships, is really just to be journaling about your interaction with patients with substance use disorder, your interaction with the consult services that exist in each of our major teaching hospitals regarding substance use disorders, and then your ongoing dialogue with your faculty advisor about the clinical experiences that you're now seeing, not only in seeing patients, but also hopefully being supported by the consult services. So really the expectation in M3 is just to elevate your interactions with patients who have substance use disorders to a conscious and a reflective level, as opposed to just sort of a brainstem level of, oh yeah, and I took care of another person with alcoholism, and by the way, they had heart failure or major depression or whatever it happens to be. So really just, if you will, an awareness and a forcing yourself to have a presence, a clinical presence to the substance use issues that relate to your patients. And then finally, in the fourth year, when most of your year is filled with nirvana, I mean electives. I think the fourth year in med school, as soon as you finish your AIs, is the closest thing to nirvana in the practice of medicine, except for still paying tuition, that you'll ever experience the rest of your life. It's pretty unstructured. And therefore, it would be our expectation that you would take advantage of the very real immersive opportunities there are in addiction medicine and addiction psychiatry here in Cleveland or elsewhere, i.e., number one, an elective, at least a 2-week elective in addiction medicine or addiction psychiatry at one of our institutions or at an institution across the country. More and more of these electives are available to MS4s across the country. And if you have a place where you really want to match or whatever, and you want them to get more face time with you, and they do have a clinical addiction elective, that'd be perfectly fine. We'd certainly encourage that and support that in any way that we can. So one is an immersive elective, at least for a couple of weeks. You might do a couple of them during the year. We also have a virtual elective on the treatment of opiate use disorder. It's a 60-hour virtual elective that you can take in your own time during the fourth year and actually frees up more vacation time. Not that anybody needs more vacation time in the fourth year. I think it's just kind of like one long year. But anyway, it frees up some vacation time for you. For moving after the match or whatever, so you're not sweating out your last few hours. It's a 60-hour elective. It's all virtual, and certainly taking that would be an expectation. And then there are 2 courses that the continuing medical education office of the School of Medicine offers for clinicians in practice that we would ask you to either take participate in during the time when those courses are happening. They're all on Zoom, or take offline, take it asynchronously, and just sign in through the CME office and take the course. One is a 3-day course focusing on how to safely prescribe controlled drugs. And that's offered 3 times a year. You can just take it when the CME office is offering it and just be one of the people on Zoom taking the course, or you could do it asynchronously. The other is a state-of-the-art course regarding buprenorphine and some of the real challenges in prescribing buprenorphine in clinical practice. Much more of an advanced course than the general buprenorphine courses that are online that are part of that 60-hour virtual course. And that's offered twice a year in October and in May, but you also can do it asynchronously. So those are the sort of requirements in the 4th year. A couple of CME courses, a virtual opiate addiction course, and then signing up for some kind of an in-person immersive experience in addiction medicine or addiction psychiatry. That's it for our actual requirements. The opportunities are greater, but that's it for the requirements. We don't currently have a research requirement in this pathway, partly because it hasn't been established long enough for us to really legitimately say, that the nuts and bolts of this are in place and you're going to be able to seamlessly find your way into a research project. There's tons of research opportunities. If you're interested in doing that, we'll assign you a research mentor, just like a faculty advisor, but an additional research mentor. And so there will certainly be opportunities for you to do research in addictions. It's just that we don't feel comfortable calling it a requirement yet, based on our track record yet. Mm-hmm. So those are the thoughts about requirements. Neera, what have I forgotten?
No, I think that's great. I think, and I love how you talked about being like mindful and present when you're seeing patients, because there's almost every other patient may have some sort of substance use disorder, be affected by addiction somehow in their life. And so I think that that's really important, because it's going to be kind of everywhere. But if you don't notice and take the time to maybe be consciously aware and present with the patient and getting deeper into kind of their story, you may miss it, and you may miss that opportunity. So it's one of those things that definitely is there, and there's the opportunities will abound in pretty much every setting. You don't necessarily have to be on an addiction consult service to be seeing patients with addiction necessarily, but it gives you that opportunity to go deeper. So let me see what I put in next. So, and we're new to this part too, and this is where Lisa may be able to help about how to do the app to apply. But I think these are the requirements. Am I correct?
There will also be, the selection form. I will be sending that out on Friday with a bunch of other general information about the application process. So sit by your phones, as we used to say.
Yes. Yeah, again, there were a bunch of really, really good questions about the application process and our selection process, et cetera. We were a little bit concerned 3 months ago, maybe, as we were thinking about and preparing to launch this pathway, that we might be limited in the number of students we could take into the pathway based upon the number of faculty advisors who we thought we might find. But we reached out to 25 or 30 potential faculty advisors, and have heard back from more than 20 of them absolutely volunteering and wanting to do this. And so I don't think that Neera and I really have a major concern about needing to limit the number of students in the pathway. The second year students are allowed to apply to this pathway. Typically, you can only apply to a pathway as a first year student. I mean, your all's opportunities to apply to pathway to the current nine pathways that are out there. Your opportunity to apply is August this year. And if you don't go into one and you wind up wanting to have been in one, it's unlikely that they'll be able to take you in after this year. But since ours is a new pathway, second year students weren't able to apply to it last year because it didn't exist. So they are allowed to apply to it. And we may get a handful of second year students who took the opioid elective and want to do this as a pathway. So we may well have a handful of second year students. We definitely have third year and fourth year students who have done the opioid elective. Many of the leaders of the opioid elective who want to be active in the pathway. They can't officially be in it, but they want to be sort of student advisors or guides or resources for you all. And so we have several students who are very interested in being guides, as well as a handful or two of relatively recent graduates who are still in their residency programs, who are interested in at least being available to you all for their experiences and such. Some in town and some out of town. So the long and short of it is, it looks like we have enough faculty and upper class student resources for us not to worry about limiting the size. So if you think that you can, number one, take the required elective, I don't know what to call it, because its name is the opiate epidemic elective. But if the opioid epidemic course, if you feel like you can take that this fall, again, probably Thursday evenings, we'll have definitely which day of the week it's going to be from the students as of Tuesday, I think, or Monday afternoon when we speak with them. If you think you can take that course, if you think once a month on Monday, late afternoons or early evenings, you can log in or come in for our seminar series. If you think you can work with a faculty advisor in a sort of self-directed learning approach to identifying what you want to learn about addictions in the next 3 months, running that past your faculty advisor, getting some advice from that advisor about how to go about learning that, and then checking in with that advisor in 8 to 12 weeks, letting them know what progress you've made and what you wanted to learn, and where you haven't been able to make progress, and then identifying some more learning objectives for your next 3 months. That's the sort of way that we anticipate kind of structuring working with the advisor. Being mindful about the patients who you see in the third year. And then finally, as a fourth year student, taking a couple of addiction electives, one of which is virtual. If you think you can do that and you have a real interest in exploring on a personal and professional level this disease, and honestly, this disease from the perspective of prevention, community-based type prevention, to identification, to treatment, to policy, and sort of community harm reduction approaches. The whole spectrum. It isn't just an addiction medicine treatment pathway, but the whole spectrum is open, and there are resources available. Then I certainly would encourage you to apply. But what are your all's thoughts, comments, questions, anything at all? As we say on Zoom, crickets, nothing but crickets. I mean, Neera and I can talk about this till midnight, but we're happy to entertain any questions or thoughts that you have.
Let me ask a question. Ted, have you and or Neera set up an addiction medicine email address? Or should they submit the application packets to you, to your emails directly?
Can
I
we have
clearly
one?
have not set one up.
Could we have one set up? Like, I know that the other pathways have. I think that's what it looks like to me.
Some of them do. We can probably set up an alias for you that'll send the emails to both of you.
I thought it was just like addiction, something like the name of the pathway. That's not automatic that we have an email.
No. Nothing. I'm the automatic.
Mhm.
Okay, it looks like there's a
Sure.
question in the chat. Could you talk a little more about what the shadowing opportunities would look like?
So there are a lot of shadowing opportunities, and they'll go into those in a lot more specific detail during that opiate epidemic student run course, because part of that course is coming to as many of the sessions as you possibly can, and then doing a certain number of shadowing opportunities. But just to give you an idea about the breadth of shadowing opportunities in the first couple of years, my gosh, by the time you're a third year, you're going to be up to your eyeballs in seeing people and families affected by addiction. But in the first couple of years, there are some examples. So one is in harm reduction. Project Dawn is the distribution of naloxone in the state of Ohio, and it was actually started in the emergency room at Metro Health Medical Center, by some really forward-thinking and committed ER docs. And so Project Dawn, the Ohio Project Dawn, really has its birth at Metro in the ER and most of its roots here in Northeast Ohio. And so there's opportunities for students to shadow with naloxone distribution and outreach experiences. The Cleveland Free Clinic, which is now called Circle Health, and I think there's some student-run health centers associated with that. But what as old people still call the Cleveland Free Clinic has a needle exchange van that has been active for a couple of decades now. And that certainly is an opportunity. So in terms of harm reduction and prevention, there are opportunities. There are opportunities in the methadone clinics in town to shadow. There are opportunities in buprenorphine or Suboxone clinics, MAT clinics to shadow. There's opportunities in intensive outpatient counseling programs to shadow. A tremendous number of opportunities to do shadowing experiences, both on Zoom and in person at 12-step meetings across the county. So those are just a few of the opportunities. We also have buy-in from the county judges in county drug court, county family court, in the county veterans court. So there's these specialty dockets in the county court system, and all of them are willing to have students come and just sit in the courtroom and listen and see how these various patient population groups are dealt with in the county court system. And then lastly, the coroner, who is the one who does the 700 or so autopsies a year, sadly, on people who've died of opiate overdose, is absolutely willing to have students come and shadow. Now, these shadowing opportunities can't all be clumped in during the 6 weeks of the actual opiate epidemic course. And so the shadowing opportunities extend throughout the first year. And so there's those kinds of things are available. What else do we have in the chat there, Neera?
So it looks like the next question is, aside from internal medicine and psychiatry, are there other specialties that you think have overlap with addiction medicine? Oh, yes. Yeah. So for sure. Yeah. So one of our fellows who just graduated is an OBGYN. And both Dr. Perrin and I are involved, and he's the president of the Ohio ASAM, where we're going to be doing a whole panel, which is also something we should talk about, maybe that they can also come to as a great meeting, statewide meeting that we're both involved in. But we have a whole panel just devoted to women's health and addiction. And we've got some leaders in the field in that area, including our fellow who just graduated, who used to work for Planned Parenthood. She's going to be on that panel, because that's a very important issue, especially now. And so, yes, there's a lot of, you could name almost any specialty, and there's some involvement, but OB, and then now we're looking a lot with pediatrics, adolescent substance use disorders, especially from the prevention side, the intervening early side. And we do have some colleagues who work in that area, who we can, and then, build some, at least some, seminars or, around that. I don't know whether there's any opportunities clinically with adolescents at this stage, adolescent addiction, but, we're very open, I think, when we work in addiction medicine, because it moves quite fast. So if we find a way to create things on the fly too, if there's a gap and there's a need. But yeah, so pediatrics, OBGYN, I work a lot with the emergency room doctors, Dr. Everman, Dr. Papp, so ED, what other specialties are involved in addiction medicine? I think.
So we've had an addiction medicine fellowship program, which is, for fellowship training after residency, since 1993 here in Cleveland, and an addiction psychiatry fellowship training program very shortly thereafter. And so we have had cardiothoracic surgeons, anesthesiologists, OBGYN docs, pediatricians, emergency medicine docs, family physicians, internists, psychiatrists. We've had people from every specialty participating in the addiction medicine fellowship program. And so I think, this is one of those diseases that cuts across every single specialty. We've had 2 pathologists take the addiction medicine fellowship program in the past, as they're drawing down on the time that they're spending in pathology and wanting to do some clinical work, but not feeling like they have really the training to work with any patient population, and have done that. So 2 pathologists who've done it as well. So I think really any of the specialties, it makes a ton of sense. I've talked a lot about the opiate epidemic, just because the opiate epidemic has sort of been front and center here in Northeast Ohio so much. But I think the addiction pathway, a person can focus on alcoholism, psychostimulant addiction, cocaine, methamphetamine, and prescription stimulant addictions, cannabinoid addictions. Prescription drug abuse is one of my areas of interest really for the last 35 or 40 years. So all of the substances. Also, one of the great resources we have here in Cleveland is that the Cleveland VA, the Wade Park VA, is one of 2 centers of excellence in the nation on the treatment of pathologic gambling. And students and residents and fellows can certainly participate and shadow in the pathologic gambling treatment program over there. So everything from sort of other compulsive disorders faculty experience and expertise in those, as well as all of the various substances. And we really, shame on me for forgetting about nicotine use disorder.
Yeah.
We're aghast at the fact that 100,000 Americans die of alcohol and drug overdoses each year, but 400,000 Americans die every year prematurely from the medical consequences of nicotine use disorder. And we've got several faculty members who are doing research in this area, as well as community outreach in this area. So certainly this is not an opiate use disorder pathway. For goodness sake, Alcoholics Anonymous was founded in Akron, Ohio in 1935 in the gatehouse of Stan Hewitt Hall. And so the treatment of alcoholism and alcohol use disorders is stronger in Northeast Ohio than anywhere else on earth. Lots and lots of opportunities. And I think our faculty advisors reflect that. We've got faculty advisors from family practice, from psychiatry, from internal medicine, from emergency medicine, from OBGYN, and from pediatrics. We have faculty advisors from all of those specialty areas and from anesthesiology. So those 6 areas, we currently have faculty advisors who have signed up and said, count me in.
And I think we touched on, could you expand on the opportunities in adolescent addiction, although we didn't specifically?
Yeah, so our addiction fellowship programs have had electives in adolescent addictions. The electives typically are taken in terms of our addiction fellows. Our addiction fellows who are either from child and adolescent psychiatry or from family medicine or from pediatrics have typically spent extra time during their addiction fellowship program in the adolescent opportunities. The opportunities that we have currently for addiction fellows, and certainly could be available for shadowing and or as a 4th-year elective for people in the pathway, involves an adolescent afternoon intensive outpatient program. So there's an intensive outpatient program, really the #1 adolescent treatment program in the region. And that is on the east side of Cleveland in Beechwood. And they are willing to have addiction fellows, and I'm sure that they would be willing to have students shadowing from the first 2 years, or if a student were interested in this and going into pediatrics or family practice and wanted to really spend an immersive couple of weeks in this in their 4th year. It's an easy thing to do because you can do something else during the morning in the first part of your afternoon, because adolescent treatment programs, their patients are in high school during the day. So they show up at 3 in the afternoon and they hang around till 6. So you could just cough up your 3 to 6 time rather than going to 1 to 1 or doing whatever else you guys do from 3 to 6 as 4th-year students, and actually do an immersive experience in the the #1 adolescent treatment program in the region. So that certainly is available.
I think also just to put in there that, like, the treatment of adolescents, I think it's so important, but also it gives in the family aspect of the disease and how much this is a family disease and the family gets affected and the family all has a role, and seeing that kind of therapy also, not just with the patient, but also in the system of the family, I think is very worthwhile, that can come from that experience of working with an adolescent, but is also something I think we need to also work and build on as we're expanding addiction treatment in general, is having more experiences around the family.
Yeah, the adolescent program that our fellows work with has its family programming on Saturday. since a lot of people are able to get off of work to some extent on Saturdays, and so they have family programming those days. And again, our fellows are allowed to participate in that from on a shadowing level, not on leading any group therapy sessions or whatever. And I would suspect that certainly we could get fourth-year students in to shadow the family program. As Neera said, here I am, the president of the Ohio Society on Addiction Medicine, and I didn't say we would expect anyone in the pathway to join the Ohio Society on Addiction Medicine. The good news is it's free, and there's a one-day conference every year, which if you can get free, you can participate in on a Friday in October. And if you can't get free, we're working on getting it recorded. So that students from any of the Ohio medical schools, not just from CWRU, although we're clearly the most important. Sorry, Neera. But from any of the Ohio med schools can access the great content that is shared each year at the OSAM meeting. Right. There was one other thing that I thought of that I have now forgotten besides OSAM. The Betty Ford Hazelden treatment centers have a summer institute where students between the first and second year, or between the second and third year, or fourth year students, if they have some elective time, can actually come to either Betty Ford out on the West Coast or Hazelden up in Minnesota and do a 1 year immersion, or 1 day or 1 week immersion experience. And we've had tremendous success getting our students into that. So I can't remember a student in the last 3 or 4 years who hasn't been able to participate in that immersion experience if they wanted to. Partly because the medical director of Hazelden and the associate medical director of Hazelden are both alumni of our addiction medicine fellowship program. And so we can sometimes pull a few strings to get students into that. So if you are interested in that, this certainly isn't a requirement, but if you're interested, we've had good luck getting students into that Hazelden Betty Ford 1 week piece.
I think one of the questions, and correct me if I'm wrong, but it's let me see, around are there any advisors with specialties outside of internal medicine and psychiatry? So yes, so it's very interesting. As soon as I sent this email out, thinking everyone's really busy, right? So I was like thinking I wouldn't get so many responses. Instantly my email was like flooded with all these different people from all these different specialties saying, I want to help, I can help, and so it was great. So we have specialties involving, like we said, internal medicine, psychiatry, family medicine, OBGYN, pediatrics, Will Goldman, I think.
Yep.
I'm trying to think of the others. ED, we have several ED physicians. I know I'm forgetting on some of the specialties. I think we have almost every specialty. I don't know about surgery.
Yeah,
maybe some of the surgical subspecialties and some we may not have, but pretty much
right.
Almost everything else we have reflected in our network.
Yep, everything but surgery. I think we have at this point. And we have a pretty big network of people who are outside of Cleveland, but who understand, kind of the school, et cetera, both in terms of alumni as well as people who've previously done the fellowship and might not be living here in town. And so we honestly, based on your areas of interest and your personal statement, would anticipate doing some matching of you to faculty advisors in a way that's pretty congruent with your areas of interest. So I think we're in quite good shape in terms of the the depth and breadth of faculty advisors. And certainly Nira and I are available to be faculty advisors as well. Although our goal would be to have each of you paired up with one of our other faculty advisors, and then us also being available to help sort of across the whole group, as opposed to us being paired with individual students. So that certainly is our goal. Other questions, concerns, comments?
Yeah, I just want to say we're very excited about this. A lot of us went through medical school and didn't have the experience of having any addiction training. I think that's a big thing, is we've all been through medical school and we're like, something's missing, right? And so just being able to offer this, and as well as other educational opportunities to medical students, is we all have a passion for. So we're very excited for the opportunity.
Yeah, we really are. Nira and I have both been working in this field for years and years. Me for more and more years, as you can tell by the color of my hair, and the paucity of hair. And there literally were years when we hoped that there might be one person applying for an addiction fellowship program. And hoping that maybe 1 or 2 fourth-year students would sign up for a 2-week elective in addictions. I now find that there are a dozen to a dozen and a half, maybe 2 dozen fourth-year students signing up for an in-person elective. 40 to 80 of the fourth-year class signing up for the virtual opiate addiction elective. And first-year students year after, or second-year students year after year, having taken an elective in the first year and volunteering to lead the elective in the second year. So, and the fact that so many of you all are interested is just, it's something that makes it just that much easier to get up every morning and think about going forth and taking care of all these patients that we all take care of every day. It really, it's just tremendous. I can't tell you how excited we are about starting this pathway and shepherding it along.
I think there's a storm coming in, so.
Yeah, it looks like there's a storm coming in. So if there aren't further questions or concerns, you all have our emails and our names. Send us emails. If you want a rapid reply, send it to Nira. If you want to reply relatively soon, send it to me. If you definitely want both, send it to both of us. And we absolutely look forward to working with any of you who wind up deciding to pick this pathway. All
right.
And take care.
Bye.
Bye-bye.